guys. Let's talk insect bites and stings. The weather's getting nice here in Michigan, and we're getting outside to work in our gardens, hunt turkeys, and look for morel mushrooms. Along with this beauty comes the beast of bee stings and insect bites. Most of these can be managed similarly. There can be some variation, and if you have any questions at all, you should be contacting me or seeking medical attention. So if you get a bite or a sting, the most common reaction, other than smacking the perpetrator, is going to be a localized reaction. That's just swelling and irritation in the area surrounding the bite or sting. Sometimes a stinger or even a tick may stay attached to the skin after the initial assault. You do want to try and remove these, but you don't want to cause any more damage to the skin. So make sure that if you're going to remove it, that you're sterilizing whatever tool you're going to use, and do not dig into the skin. Only grab and pull on whatever portion is still external. Next, you're going to want to clean the skin well using alcohol or soap and water. And if you develop, some itchiness and very mild swelling, you can use topical hydrocortisone. You can take some oral Benadryl, and that might be enough to relieve your symptoms. If you're removing a tick and you're able to get the body off, but the head is still in the skin, don't try and dig it out. This actually increases the chance of infection. And the recommendation is to go ahead and just leave the head in there. Your body's either going to push it out or it's going to gobble it up using, its own mechanisms. So, the body is actually what contains the microorganism that causes Lyme disease. So as long as that body's removed, it's okay if the head's in there. It's not going to move forward and cause transmission of Lyme. A tick actually has to stay attached with the body attached for around 72 hours to transmit Lyme. So if you recognize it pretty quickly and get the body off, then you're pretty safe from Lyme. If you do get a bite or a sting and it's getting more red or swollen or tender, and I'm talking like 2 days after the initial bite or sting, that's a good time to schedule an appointment with me at mmqc.org. There is a chance that this localized reaction has been hanging out long enough to turn into a skin infection. And at that point, you would require antibiotics to get it cleared up. If a tick has been attached for at least 2 days, that's when I draw the line and I go ahead and test for Lyme disease. That's not something that we do at mmqc.org, but you can get a Lyme titer at most urgent cares. You can get it through primary care, and you can get it done at an emergency department. If you notice a bullseye rash forming after a tick bite, that's known as erythema migrans, and that is a sign that you have Lyme disease. And at that point, you definitely want to get on antibiotics tailored to treating Lyme disease. Lyme disease has a huge range of symptoms, and if there's any question at all, you should be going to get evaluated. If you're bit or you're stung and you develop shortness of breath, difficulty swallowing, swelling of the face, tongue, lips, or throat, call 911. If you have an EpiPen, use it. Just don't let the bugs keep you from enjoying the glorious outdoors of Michigan. This time of year is one of the reasons most of us deal with the winter. So get out, have a great time, and stay healthy.